Hey, Caroline, how are you?
I am fantastic, Rob.
Today we're going to be talking about a subject that is not uncommon in the benefit world over the last several years, and that's around focusing on mental health and what companies should be doing. And we're going to spend a lot of time on the financial impact and productivity of mental health in the workplace. But more so, our guest today is with an organization that has put out a great paper around the cost of inaction, uh, why businesses must prioritize mental health, especially in disability management. And we have a great guest today, Caroline.
We do. We're going to have the opportunity to talk to Laura Pratt. She's the National Director, Organizational Health, Workplace Benefits, and Retirement. And you can just tell, I've spent some time with Laura in the past. Her passion shines through here. She and her team have looked at years and years of data and how they can help make a difference. And I think what we're really going to find today is, yes, mental health and wellness is such a prevalent topic. It's so broad, but I think we're going to get some really great solutions that people can read about and understand that it's not just about compassion. It is a business strategy that you can actually take action now and get some ROI, and make meaningful change within about 1 to 3 years. So let's bring Laura in and see what she has to say. All right, we want to welcome in Laura Pratt from Canada Life. She's the National Director for Organizational Health, Workplace Benefits, and Retirement. So welcome, Laura. If you want to tell us a little bit about your background and the topic that we've chosen today.
My background, I've pretty much spent almost my entire career in essentially the disability management space. But I think what I've been happy about is that most of my focus has been plan sponsor. So, how do plan sponsors build a workplace that is best designed to avoid disability claims and to keep people healthy and productive at work? That's what I've been doing over the last number of years, working directly with plan sponsors. I have a team of folks who do the same thing. So we're, a real like-minded team of individuals focused on prevention of disability as well as management.
Well, and that's great to hear, Laura. And for a lot of organizations, disability has been first of all, usually the premiums are paid by employees, and it can be viewed as not only just a cost that's steadily gone up over the years that I know we're going to touch on for reasons why, but at the same time it can get expensive at times for people as well. And so instead of looking as a cost, I always find it interesting that people might not be aware that Can Life had a long-standing interest in really advancing workplace mental health. Maybe you could speak
Mhm.
to some of those strategies that I know you've been involved with directly over the last 20 years.
Yeah, for sure. We have had a long-standing interest. In fact, it's back to 2007. We launched a resource focused on workplace mental health, which at the time was called the Center for Mental Health in the Workplace. Some people might remember that name. It evolved into the current resource, which is called Workplace Strategies for Mental Health. It's publicly available, and we're approaching 2026 now. In 2027, it'll be 20 years of investment and advocacy in workplace mental health. And as to the why part of your question, Rob, we launched it as a free public resource because we wanted to arm workplaces with actions that they could take. We're a benefits provider. We see the impact of mental health concerns in the workplace every day. And so we thought that this was something that we could focus on by supporting research and initiatives that can increase knowledge and awareness of workplace psychological health and safety, and offer practical solutions and tools that workplaces can turn into knowledge and action, and that really to help anyone in the organization respond to mental health issues at work itself. So we tailored workplace strategies for mental health to speak to a variety of different audiences. So if it's a workplace audience, they can find a roadmap for implementing what's called the National Standard for Psychological Health and Safety in the Workplace. Many organizations, I think in Canada, are still not aware that this is a standard that has existed, but it's around 10 years now in Canada. It's a set of voluntary guidelines and tools and resources that are there to guide organizations to promote mental health and prevent psychological harm at work. And workplaces can also find guidance on developing policies that align with the standard.
That's great. And we'll make sure we put this in the show notes so other people can be aware and download it.
Yeah, and a lot of the conversations I'm having with plan sponsors are around, when you talk about health and safety in the workplace, this part of it. Looking
Mm.
psychological health and safety is important, and that voluntary standard is there to provide guidance in that respect. But then also within the workplace, you have, of course, leaders. We wanted to give education and training resources so that leaders could equip themselves to manage their teams in psychologically healthy and safe ways. And then individual employees within the workforce can also find access to resources and tools that can help them address the things that they're facing. So it could be conflict between coworkers, or bullying, or accommodation, or just general well-being resources as well.
Oh, that's great. And with such a long-standing history of investment in time and talent in this, I can see, a lot of the public resources that have come out. And there is a recent report that is called The Cost of Inaction and Why
Mm-hmm.
Businesses Must Prioritize Mental Health and Disability Management. So let's talk about that. Why was that report produced?
Well, we've seen mental health costs rise, and it's been a considerable concern for workplaces in Canada. And we see the downstream impact of mental health issues, as I mentioned, in our disability management practice. So we wanted to be able to help workplaces address those and to create a healthier workplace for everyone. So the report is positioned from the perspective of disability management, but the purpose of the report is to minimize the risk of disability happening at all through proactive strategies that workplaces can take. The trend of rising mental health disability claims and the associated costs can be a pretty significant challenge for businesses, not only in terms of financial strain and sustainability. We talk about sustainability all the time now with benefit plans, but also in the broader impact of culture and engagement and productivity in a workplace.
Is this report really just reflective of Canada Life stats over the years, or is it other organizations and industry stats that allowed you to put this report together,
Yeah,
Laura?
it's both, Rob. We've drawn on years of the data that we've collected for sure, but we also drew a lot of valuable insights from over 30 other sources of data in various surveys and reports. So we really were conscious of wanting to look not only at current trends, but shifts that have shaped the workplace landscape that we're seeing today.
The great news is that mental health is more of an everyday topic and conversation just in general in society than it was, say, 5 or 10 years ago. And, Laura, correct me if I'm wrong, but it wasn't that long ago that really like anxiety or burnout or any type of mental health situation really wasn't recognized as a disability, long-term disability at all. So it's great to see that we've seen this advancement. But when I see some of these stats, like to show that the rise of major depressive disorders among Canadians that are 18 years or older has
Mhm.
gone from 6.7% pre-pandemic to over 17%. For argument's sake, it's almost tripled.
Yeah.
Like these are pretty comprehensive stats. So the importance of doing something versus doing nothing at all, I think this is where I think all organizations got to pay attention, correct?
Yes. Yes. And in fact, we looked at a variety of different ways to look at the cost. We looked at the Center for Addiction and Mental Health, CAMH, as we know it, produced a workplace mental health report, and they looked at the economic burden of mental illness in Canada. And so we all kind of talk about disability trends for mental health being in that 30% range. If you look at a primary diagnosis, that would be kind of an average percentage that we would see. But they looked at mental health accounting for 70% of workplace disability costs. And what they meant by that is they were looking at the broader economic burden. So they looked at things like, for example, absenteeism due to mental illness. That's prevalent in Canada, and workers with mental illness are more likely to be absent from work due to mental health concerns or due to health reasons rather than any other workers. And those absences are also likely to be longer, which means colleagues have to step in and take on additional work and compensate for the absent employee. So that leads to more stress and less productivity in the workplace as well. Another cost that they looked at was presenteeism. And of course, there are various reasons why employees may come to work while they're perhaps not feeling their best. There may be financial pressures or feelings of personal responsibility to complete tasks or attend meetings. or worry about work accumulating while you're away. So, or they might just be insecure about their job due to things that are going on, whether there's downsizing or restructuring. So when employees come to work despite feeling unwell, their performance suffers, their ability to concentrate is impacted, they may have reduced cognitive performance. So ensuring that employees have access to support and treatment is essential. And employees who receive treatment for serious depression are more likely to be more highly productive than those who do not. But that's really what they were looking at when they looked at the total burden of 70%, all those
Yeah.
factors.
It's a huge number. I think about some of the past episodes we've filmed regarding mental health and wellness. A lot of this comes back to a leader being able to spot
Mm-hmm.
their employee, their team member behaving in a different way than usual, right? And then finding the right way to ask that question and in a supportive way to help employees through this, or acknowledge and ultimately find assistance. Because I know for plan members, employees, oftentimes you're in it, you don't necessarily recognize that you're not at your best, but you also feel overwhelmed to even know, how do I research what's in my benefits booklet, how
Yeah.
can I get support? So is there something that you would comment regarding that role of the leader, and how to help that plan member employee speak up?
Yeah, I think that we talked earlier about leader training.
Mm-hmm.
A lot of that, a lot of that training focuses on how to have those conversations, how to make the individual feel comfortable to talk about
Mm-hmm.
what they need. Sometimes it's navigation role, helping them know what resources are available. It's not always easy, especially when you're feeling unwell. That's not the best time to try to navigate complex documentation or websites or whatever the case may be with respect to how those resources are laid out for employees. So the leader can play a bit of that navigator role to help to the extent that the employee is wanting to share their concerns with their leader directly. But there is a lot of, in workplace strategies for mental health, there's a vast amount of information and guidance for leaders around how to have those conversations, how to maybe even just to share resources with the employee and help them self-serve those resources as well.
So when we look at Canada Life's block of business, Laura, what disability trends are you seeing right now?
Well, we've seen, I mentioned earlier that mental health claims continue to increase. We've seen them increase both in terms of the volume of claims and the cost that's driven by duration more than any other diagnosis category. We did a 10-year study. So we looked at the period of 2014 to 2024 for mental health specifically. And in short-term disability, we saw claims increase from 17% to 24% on average in that 10-year time frame. And then looking at long-term disability, we saw an increase from 29% in 2014 to 37% in 2024. And we also talk about what are the top basically drivers of cost in any disability program. It tends to be mental health and musculoskeletal. But we have seen the gap between mental health and musculoskeletal widen in that same 10-year period. So if we look at LTD now, in 2014, it was mental health 29%, musculoskeletal 25%. 10 years later in 2024, it's mental health 37%, musculoskeletal 21%. So we expect that trend to continue. We also see that long-term disability claims are increasingly complex, and it's not unusual once somebody reaches LTD to actually have more than one diagnosis, polymorbidity. And so we are seeing, in fact, in 2024, that just shy of 70% of LTD claims have a secondary diagnosis that is also contributing to their disability. And for 69% of those claims that have, for those 69% rather, that have a secondary diagnosis, 46% of those are a mental health related diagnosis. So when you talk about how much mental health is impacting disability trends, it's both a primary and a secondary diagnosis story. So it's more than just the primary diagnosis stats that I was mentioning earlier.
And these are staggering numbers when you consider like these percentages and at the rate they're increasing at the same time. So when organizations consider investments in workplace well-being, Laura, where you specialize, the challenge they often face that I find that HR leaders would face, whether they're going to maybe leadership above them to finance, is that business case, like why we need to focus on it. Because sometimes, certain situations you can see a certain return on investment at a certain time, but it's difficult to prove and quantify the returns. But hearing some of these numbers, what are strategies that you would recommend to companies when, when they're thinking of that ROI on workplace wellness?
Yeah, and how to get the decision makers on board. I think everybody
Right.
intuitively understands the benefits of a mentally healthy workplace. As I said, people are engaged, high productivity, resilience, coping with change, and everybody's dealing with change in their workplace all the time. Engaged, productive, and resilient workers have lower rates of absenteeism, disability claims, and higher retention rates. So that's the broad business case, but it doesn't necessarily give you, as you said, Rob, the ROI that you need to convince the decision makers to take those specific and targeted steps. That's where it gets difficult because no organization has an endless sum of money on hand. So we always have to think about cost and plan sustainability. That's top of mind for any organization. So they'll want to balance coverage needs and evolving employee expectations with cost control and plan sustainability, of course. The what we did find in the cost of inaction report is that as a result of work completed by Deloitte, they were able to show a positive ROI on workplace mental health initiatives is really within reach. They looked at 10 companies, both at real world experiences and various sources of data, and they were able to establish a median yearly ROI of $1.62 for every dollar spent. And after 3 years, as the programs matured, that return actually increased to $2.18, so more than double the investment. And of course, programs are more likely to deliver greater results as they mature. So it's best to kind of look at that 1 to 3 year period when you're looking to achieve that ROI.
Yeah, so with stats like that are available, it really speaks to, does it mean that workplaces across Canada are recognizing the need to implement mental health programs? Are we already there?
Kind of. I mean, we have the impacts of mental health in the workplace are increasingly recognized. It's a frequent topic of conversation. Any meeting I'm in with any plan sponsor, there's a mental health conversation happening, absolutely. But stats show that 1 in 3 Canadian employers have an actual defined mental health strategy in place. And those who do have a strategy in place may not actually be measuring the effectiveness of the program. So without both a strategy and a defined process for evaluating the impact of that strategy, organizations are going to struggle to find that their actions are actually having any impact at all, and that puts those investments at risk.
In the cost of inaction report that Canada Life put together, it talks about creating a psychologically safe workplace.
Mhm.
And it refers to creating a national standard.
Yeah.
And, Laura, what would a psychologically safe workplace, what would that be? What would be involved in creating that type of
Mhm.
standard in your eyes?
Earlier, we talked about the concept of safety and psychological safety being no different than any other safety programs that you have in a workplace. So, a psychologically safe workplace, psychological safety is the absence of harm or threat of harm to mental well being that an employee could experience. And in a psychologically safe work environment, employees feel safe to speak up, to take risks, to be authentic without fear of punishment or ridicule. And it's really foundational to a healthy and productive workplace. Without that feeling of safety, employees will be less engaged, less motivated, and you'll likely see higher turnover. So the report provides links to free resources to help workplaces. And I mentioned the National Standard for Psychological Health and Safety in the Workplace is one of those, as well as Guarding Minds at Work and Workplace Strategies for Mental Health. And you can link to all those resources within Workplace Strategies for Mental Health. And these resources can walk workplaces through the steps to create a psychologically safe workplace. And that means in identifying and addressing risk, training, supporting diverse needs, and removing barriers to mental health care. And throughout our communications with and interactions with Canadian workplaces, we've found that those that prioritize mental health actually integrated into every aspect of their culture. So, right from the beginning, from hiring and onboarding, training, ongoing engagement, performance management, mental health is a fundamental part of daily operations. It's not often its own silo or kind of an afterthought.
Very key. And it all comes down to resources, right? And looking at what workplaces out there should consider to support mental health. Are there any out there that may not immediately come to mind as being linked to mental health?
Right. So, I mean, of course, what would come to mind would be the traditional employee and family assistance programs, of course, but there are others. If you consider mental health as connected to physical health, financial health, social health, you recognize that there everything that you do in the well-being space can have an impact on mental health. So even things like virtual health care, so reducing stress for families, making sure that they can access care at a time that's convenient for them, wellness and prevention benefits, access to nutritionists or gym memberships or group health, group savings plans, financial education, leadership programs I mentioned earlier to help leaders build their skill sets to contribute to a psychologically safe workplace. And then even programs related to absenteeism and disability management, recovery and return to a successful return to work, a sustainable return to work. All of those are tied to uh, workplace mental health. So, the Center for Addiction and Mental Health says mental health is health. And I think that's really the right way to look at it.
And in the report, which I think is great, you highlight an organization in particular that's you think has done some pretty innovative and proactive measures. Can you talk a little bit about them?
Yes, I'd be happy to. The organization we profiled is Henry Schein Canada. They're a worldwide distributor of dental and medical supplies for health practitioners. They have right around 800 to 900 employees in Canada, most of whom participate in the benefit plan. And they've made employee wellness a core part of their company culture. They started off by defining 3 goals. So their goals are improving employee well-being, enhancing employee engagement, and reducing disability claims. And to do that, they decided to focus on some well-being pillars: mental, physical, social, financial, and work-life balance. So everything that they do from a well-being perspective needs to align to those pillars and those goals. And I talked earlier about ensuring mental health and psychological safety are built into every aspect of work life. And that's what Henry Schein has done. They introduced the wellness program and its pillars right at the point that the employee is onboarded. They reinforce wellness as a company priority. They have expanded benefits for mental health care, and they actively promote those resources to make sure they're utilized, which is really key. And they've developed training and policies to help ensure people are treated with respect and civility and dignity. And this creates an environment where people feel safe to speak up, receives mental health first aid training to stay up to date on best practices. And they've developed a dedicated team of wellness champions who promote well-being to their fellow employees across the country. And that links back to making sure people are aware of what's available and that services are actually being utilized. So what did they see? Henry Schein actually saw measurable results. They saw reductions in short and long-term disability claims, stronger return to work outcomes, and a recent engagement survey reported a 90% approval rating for their wellness initiatives. And they achieved those results because they defined their goals, they defined their strategy, and they defined how they were going to measure their results. And I mentioned one common topic of conversation with plan sponsors is the concern that employees don't know about well-being initiatives, that they aren't being used, or is the investment actually worth it? Are they achieving the outcomes that they had hoped to achieve? But what Henry Schein has done to secure the value of their investment is ensure people are aware of them and using them in their communication strategy, beginning at onboarding, continuing through leader training, and then promotion through their wellness champions, I think is the reason why they've been successful.
Great to hear. Great
Yeah.
stuff.
I'll comment that at Benefits Alliance, we've got a mental health and wellness committee who, was very passionate about trying to make sure there was on the ground support and resources across the country. So they made champions in each of our member firms. And I think that's so powerful. I mean, you can set the goals, but then you have the boots on the ground ready to, reinforce that culture and that strategy. So quite a lot. We love case studies. So that was great hearing about that. And mental health is such a complex issue. I feel like I read the report, but now I want to go read it again. So let's pretend I'm reading it again for the first time. For our listeners, what will they take away? Can you summarize what are the key takeaways, and that will maybe inspire people to crack it open this evening?
Yeah, I think that there are a lot of mental health reports available, but I think we wanted to say, hey, it's not just about understanding mental health, being compassionate to mental health as a concern, but it's a smart business strategy, and we wanted that to really address that component of it. We wanted to share that the consequences of poor mental health extend far beyond the individual who's impacted, and there's a unique opportunity for organizations to drive meaningful change by making those investments and expecting that those investments will pay off, provided they've defined their goals and their strategy and the way they're going to measure it. And we believe that workplace cultures that prioritize mental wellness will be stronger and more resilient in the long run, both the employees and the businesses themselves.
So this has been amazing information that our listeners have heard today, Laura. And so if we really want to summarize it, whether you have 800 employees or you have 8 employees, doing something is better than doing nothing. So if you're a small, mid-sized company, even like 20 employees, 30 employees, 40 employees, do you have any recommendations of just things that they could start with and implement tomorrow, just to get the ball rolling, into whether it's on discussions or providing options to members? What would you recommend?
Yeah, I think that the takeaway, I believe in the show notes, we've provided the link to the report itself. So certainly there are a lot of helpful links within the report. There's when you go in and pull the report, there's also an infographic. So there's data there, just focusing in on the stats. But I think also I would suggest, if organizations or individuals would like more information, if they go to workplacestrategiesformentalhealth.com, which is the site I've been referring to throughout our discussion, it's very easy to navigate through. They can find, depending on who the audience is, if they want to look at employee resources or leader training or developing policy. If a smaller organization may not have any documented policies that relate to workplace mental health, but might want to start, and there's great guidance on how to do that across a variety of different topics. So I would suggest starting there. There are also packaged workshops that organizations can take. They can deliver as a lunch and learn or as a team initiative on a variety of mental health related topics as well. They're all ready to go. There's a PowerPoint presentations, there's videos, there's facilitator guides. They're built to be delivered by anybody. You don't have to be a mental health expert to use these resources. They're really designed to pick up and work with by anybody in the organization.
Great. Well, I think one of my biggest takeaways today is that, yes, you want to have a spot where you're a compassionate supporter of employees, but it's also a business strategy. What I've learned today is, there's a really unique opportunity here to really drive meaningful change, but also any investment you're going to make, you're going to see that back within 1 to 3 year period, it sounds like. So this is key. I love the do something, then nothing, and know that this will pay back. So I want to thank you, Laura, so much for coming on the Benefits Alliance Voice today. It's been a pleasure learning all about the great work that you and your team have been doing that will benefit Canadians across the country. So thank you.
Thank you for the opportunity.
Thanks, Laura.
This has been the Benefits Alliance Voice. If you enjoyed this episode, please share it with your network and be sure to check out the podcast notes for any additional materials.